Hi, I'm Mariam Eskander. I'm a GI surgical oncologist at the Rutgers Cancer Institute of New Jersey. We can think about barriers to clinical trial enrollment in two big groups. One is at the system or the hospital level, and then the other is at the individual or the interpersonal level. When you think about the system, are there clinical trials available at a hospital? We know that many minority patients go to under-resourced hospitals that may not have the money or the resources to have clinical trials available there. And then in regards to those clinical trials, who is eligible for them? Clinical trials have something called inclusion criteria, which say here are the criteria for who is eligible or who can join this clinical trial. And oftentimes those criteria say that people with kidney dysfunction or heart dysfunction or uncontrolled diabetes or certain lab values that are not normal can't join the trial. And this can be exclusionary and discriminatory to patients of color because we know that certain populations have higher rates of diabetes and have higher rates of kidney disease and heart disease. And so sometimes even the way we design trials can be unintentionally discriminatory to people of color. At an individual level, are doctors talking to their patients about clinical trials? Do they know that clinical trials are available for that particular patient? And is there some element of implicit bias or negative perception that makes them less likely to talk to certain people about trials? Like, do they think that some people might not comply or might not want to join? Or if they have perceptions about certain patients not trusting the healthcare system or not trusting the facility. And sometimes that influences whether a doctor will talk to someone about a clinical trial or not. And then from the patient perspective, does the patient know what a clinical trial is? What's their perception? What's their awareness of a clinical trial? And sometimes people have cultural or personal beliefs about trials. And sometimes they just don't know what a trial is and are afraid of trials because of historical precedent. It's important here to note that studies show that minority patients, when they're asked to join a clinical trial, so when they're actually asked, are just as likely to join a trial as white patients. So sometimes it's simply the being asked. Right? Why are people not being asked? And then finally, we know that there's a relationship between social determinants of health, so things like poverty, underinsurance, lack of neighborhood resources, and race in this country because of a long history of institutional and systemic racism. And so sometimes people just live too far away from a trial and don't have the transportation to get there, or they have, childcare issues or job issues or some other logistical or financial reason not to be able to join.